All right, everyone, thanks for joining. I know we hit 2 o'clock Central Time. I see folks coming in still, so maybe we'll give it a minute or two before we hop into content. So thanks everybody for joining us this afternoon. All right, well, we'll let people keep filing in, but I think we can go ahead and jump in. So as you know, thanks for joining us today. We'll be talking about the MSD Solutions Index and the findings that we had from our inaugural MSD Solutions Index that was launched in 2022, 2023. And just to preface, the MSD Solutions Index is a survey designed to evaluate an organization's musculoskeletal disorder or MSD prevention initiatives. And so today we'll be diving into the results from the survey and discuss what organizations are doing to promote worker health, safety, and MSD prevention. So just a brief look at what we'll cover today. So I'm going to kick us off in talking about the MSD Solutions Lab itself and really what our mission is. And then I'll discuss a bit about the development and background of the MSD Solutions Index. And then I'll toss it over to my colleague Taylor to walk us through the actual findings from the index. And then we'll wrap up by talking about our future plans and ways to engage with the lab that are coming up. And just to set expectations, Taylor and I are feeling like we're going to spend about the first half hour reviewing the index findings and discussing other content. And then that'll save us plenty of time for Q&A at the end. So please do utilize that Q&A box. And you can ask us some questions as we're going through or save them for the end. And with the time remaining at the end, we will get to the ones that we can. And before we get too much further, we can also take a brief moment to introduce ourselves. So I am Dr. Paige DeBelo. I'm the research manager for the MSD Solutions Lab. I have been with the National Safety Council a little over 2 years, and I've really enjoyed developing the index and getting to progress the lab's research agenda. And I'm joined today by my colleague, Taylor Mosser. And so Taylor, feel free to go ahead and introduce yourself.
Thank you, Paige. My name is Taylor. I'm a research associate with the MSD Solutions Lab. I have been with the National Safety Council for just under 2 years, and I'm really proud of the work that we've gotten out of the index, and we're very excited to show you those results today.
Awesome. Thank you, Taylor. And so let's do a little bit of homework here to discuss a bit about the issue of work-related MSDs and discuss more about the lab and what our thesis really is. So those of you who are familiar with the National Safety Council's MSD Solutions Lab probably know by now that MSDs aren't just one of the biggest safety challenges facing today's employees, but they're also one of the biggest challenges to operating a successful business that today's employers might face. And so in fact, MSDs are the second leading cause in shortening employees' possible working years among many other detrimental outcomes that are caused by MSDs. But it also goes without saying that launching any new safety initiative is really an investment. But as business leaders and safety experts more closely look into this issue, unmanaged MSD risk can be even more costly. And so each year we see that US private businesses are losing about $17 billion in lost wage and medical expenses. and it's well recognized that these injuries and costs can impact organizations of all sizes and across all industries. And so it's for those reasons that NSC, with funding and support from Amazon, has been so focused on addressing workplace MSDs through the groundbreaking MSD Solutions Lab these past couple of years. And our goal isn't really just to sound the alarm on safety issues, but to challenge the long-held assumption that MSDs are just the inevitable cost of doing business. So we're really working to ignite meaningful action across the global businesses and safety communities to solve the work-related MSD issue. And so in a nutshell, our goal is to create safer outcomes for millions of workers across the globe to collectively reduce MSD risk and injuries. And to date, over 180 organizations have already joined the MSD Pledge and committed to actively addressing and reducing MSD risks in their own workplaces. And so this covers almost 3 million employees by the pledge, and we're excited to see this initiative continue to grow into the years to come. One way this initiative itself is continuing to grow is that we have launched MSD Pledge 2.0, which happened late last year. So MSD Pledge 2.0 adheres to the same core tenets of the original MSD Pledge, with the added opportunity that organizations are encouraged to determine their own unique MSD risk reduction goals. And we really know that goal setting and goal development around safety and MSDs can be really organization dependent. And we wanted to recognize that individuality through this new iteration of the pledge. So organizations are still asked to commit to analyzing their causes of MSDs and MSD risks, and are asked to innovate and collaborate with their peers to share learnings collectively to improve safety practices and to foster cultures of safety where all employees are held accountable for the safety and health of workers. All right, so now that we've had just a little bit of background on the MSD Solutions Lab itself, we can jump into talking about the index. So I'll give you a little bit of the index background, the purpose, and its goals. And so the MSD Solutions Index was really designed to measure MSD prevention at the organizational level, with the added benefit of being developed by a third party, which was MSC. It's designed to not only provide organizations with feedback about their risk reduction initiatives, but to also provide feedback on less focus on factors of MSD prevention. And so these are factors like workplace safety culture, levels of innovation and technology readiness, and other non-physical risk factors of MSDs that address psychosocial factors and mental well-being. The MSD Solutions Index also provides benefits to pledgees, including the ability to benchmark or compare results on the index with other companies, the ability to track their own MSD prevention progress over time, since the survey is completed annually, and organizations do receive an individual report highlighting their areas of strength and opportunity. And it really holds organizations accountable to their pledge commitments. And so we know that we could just invite people to sign the pledge and then they could kind of move on about their day-to-day operations and not really look inward to make changes. And so we're really hopeful that by taking the index and benchmarking against themselves and other organizations, that organizations will really feel held accountable to those pledge commitments and work to improve their MSD prevention initiatives. And so with that, we can do an overview of how the items on the index were sourced, written, reviewed, and finalized. And so items within the index are aligned to the 3 main pledge commitments that we covered of risk reduction, safety culture, and innovation and collaboration. And how we actually generated these items. So we used a handful of resources, including research on MSD prevention and current risk assessment tools, and input from internal and external experts. We also went through a rigorous external review phase with our MSD Solutions Lab Advisory Council, which is made up of industry experts, folks from government entities, folks from academia. So a really well-rounded group who has a lot of experience in the MSD prevention world. And so after that advisory council review, they were able to review the survey with the 3 pillars kind of one at a time and also more holistically. We landed on a total of 46 items for the index. And so within those 46 items on the index, there are 22 that address risk reduction, 17 that discuss a culture of safety, and 7 on innovation and collaboration. And so up on the slide, you'll see that there's just kind of a sample of an item that would fit into each of those 3 buckets. So something for risk reduction would be like, which of the following factors are considered when assessing and improving jobs with MSD risks? Something for culture might be related to communication. So our workplace has open communication between workers and managers and supervisors regarding MSD risks. And then innovation and collaboration might be something about their readiness to uptake technology. So what is your organization's position regarding adopting technology for MSD prevention and reduction? So even though organizations' individual index results are confidential, organizations receive personalized reports about what they're doing well and areas of opportunity to strengthen their MSD prevention efforts. And so in those reports, participants receive an overall index result, as well as results for 3 subsections of risk reduction, safety culture, and innovation and collaboration that fall into one of the 5 categories that you can see here on your screen. So that's innovating, proactive, advancing, reactive, and novice. And so this is presented within organizations' individual reports along a barometer like you can see here. So they can really get a nice visual of how they're performing on each of the subsections and overall on the index. And these individual reports are sent to all pledgees who complete the index. These reports are designed with the idea that organizations could share them internally to raise awareness about current MSD prevention efforts and to generate opportunities for collaboration and organization-wide involvement in safety. These reports really focus on successes and opportunities for organizations. And increasingly, as we're collecting this year-over-year data for organizations who participate in the index annually, we're able to make comparisons of the organization's responses between those years to show them where they're having growth in areas or where maybe they're having some declines. And so below you'll see on the screen here just a couple snips of the kind of information that's presented to organizations in their individual reports. And alrighty, with that, I will pass it over to Taylor to really dive into the results that we saw for the first year of the index.
Thank you, Paige. As Paige mentioned, we're going to start to go over some results we saw in the first year of the index launch. This includes areas of celebration, as well as areas that we've identified for further improvement. So to start off, the first year of the index was launched between 2023 and 2022 and 2023. During that first year, 52 organizations responded to the index. The survey is completed by one representative of the company, though collaboration is encouraged. Respondents will receive a link to their organization, and they can return to that survey link if they need to verify answers with others in their organization. Of respondents, 87% completed the survey for their entire organization, as opposed to a specific site or location. 89% of responding organizations are headquartered in the United States. And finally, 83% have some form of MSD or ergonomics program already established in their workplace. Now, as Paige touched on earlier, the index was analyzed in subsections and as a whole. And in terms of the whole overall index results, the graph on the left shows the breakdown of these results by category, so by the barometer that Paige showed a moment ago. This shows that these categories range from novice to innovating, and nearly half of the respondents fell into the proactive category with their overall results. This shows that the pledge community is doing well in MSD prevention, but still has some room for improvement. Additional findings from the overall index show positive and significant correlations between the overall index results and other key variables. This means that as responses to the identified variable increases, the overall index results increase as well. These correlations were found with the extent to which human factors are designed into work processes, whether or not employees are provided with ergonomic tools and equipment, level of trust between workers and other levels of the organization, and level of frontline worker involvement in determining work features. However, we did not find any significant correlations between overall index results and the industry an organization falls into, an organization's size, or how long they've had their MSD program established. This is actually an encouraging finding because it shows that organizations can do well on their MSD journey, even if they are a small company or just starting out on their MSD prevention efforts. Now moving into the first subsection of the index, which is the risk reduction section. This contained items covering topics such as risk factors and current MSD program features. And as you can see in the graph, the results for this section were almost perfectly normally distributed with a nice symmetrical curve and most of the results falling under the central advancing category. Analysis showed positive correlations between these risk reduction results and an organization's size and how long their MSD or ergonomics program has been established. This finding does make a fair amount of sense, as risk reduction efforts are more likely to be developed and perfected over time. We also expect that larger organizations may have more resources to devote to things like risk assessments and audits. Additionally, over 3/4 of respondents utilize employee feedback to determine where improvements are needed in the workplace. We also found that lagging indicators, such as OSHA logs or workers' compensation claims, are more commonly tracked than leading indicators, which are things like program audits or early reporting. And in terms of current MSD interventions, 42% of respondents employ personal level interventions, such as PPE. 46% utilize organizational level interventions, such as workstation redesign, but only 4% of our respondents employ systems level interventions, such as automation or robotization. Finally, only 65% of respondents currently track MSDs in their workplace. We would expect this number to be higher since respondents have pledged to reduce MSD risk, and it's a demonstration of the room for advancement that is indicated by the distribution of the graph. Additionally, we pulled out findings from 2 specific items in the risk reduction section, and these items asked about the top risk factors seen in the organization, as well as the top body parts that are impacted by MSDs. The top 5 risk factors that we saw in the community were awkward postures or excessive bending or twists, lifting or carrying, repetitive activities, specifically computer-related, prolonged sitting or standing, and pushing or pulling. And the top 5 impacted body parts seen in the community are shoulder, low back, wrist, neck, and knee. Now, looking over these responses, these findings do make a fair amount of sense. The 2 industries that we saw the most representation from in the index this past year are manufacturing and professional, scientific, and technical services. And the top 5 risks and impacted body parts we're seeing are consistent with other research within those industries. So moving on to the next subsection of the index, which was safety culture, here we see that the results were a bit higher. As you can see in the graph, the majority of respondents fell into that proactive category, that light green category, showing that there's more developed safety cultures across respondents. Analyses showed many correlations between safety culture results and other relevant variables. There were positive correlations found with results on innovation and collaboration subsection, the extent to which human factors are designed into work processes, whether or not frontline workers are provided ergonomic tools and equipment, the level of trust between frontline workers and other levels of the organization, frontline worker involvement in determining changes, and use of employee perception surveys. So again, as one of these variables increases, so for example, if an organization reports higher levels of worker involvement, the result on the safety culture subsection is likely to increase as well. Under additional findings, while many respondents indicated open communication in their workplace, roughly 1/4 of respondents feel that their senior leadership does not communicate the importance of MSD prevention. We also pulled out specific responses in this section as well, starting off with the degree to which frontline workers were involved in various work practices. 65% of respondents currently conduct employee perception surveys. 87% have methods in place for employees to make suggestions regarding safety. And finally, frontline workers are most often involved in decision-making as it concerns workstation design, job task redesign, physical work environment, workflow, mental health and well-being, work schedules, and return to work processes. The other item we pulled out asked about non-physical risk factors that may be influencing MSDs, things like work stress, organizational structure, so on. Since we know that MSDs are multifaceted and are caused by more than just physical risk factors, this is an important item. 84% of responding organizations do believe that non-physical risk factors play a role in their workplace, with the most commonly cited non-physical factors being mental fatigue, lack of training, lack of personnel, and lack of equipment or tools. Now moving on to the last subsection of the index, which is innovation and collaboration. In comparison to the safety culture subsection, you can see in the graph that the results on the innovation and collaboration section trended a bit lower, with the majority of responses falling into the reactive category, or that light orange, showing more room for development in this factor across respondents. In terms of innovation, 82% of respondents are currently involved in MSD prevention technology solutions. We do know that technology is becoming a major topic in safety and health right now, and it's great to see so many organizations already engaging. But we know that this is an area that we can continue to devote more resources and attention. In terms of collaboration, 83% of respondents share effective MSD prevention solutions internally with other departments or sites within their organization. However, just over half of respondents share those solutions externally with other workplaces. While above half of respondents sharing externally is great to see, we at the lab hold that MSD prevention works better in a collaborative environment. And that is the belief that's the inspiration for the MSD Solutions Lab in general, as well as the index. So now that I've gone over findings by sections, I want to dive a little deeper into areas that we've identified as being well developed in the community, as well as some areas that can use some more dedication and focus in the future. So starting off with some areas of celebration in the risk reduction section, over half of respondents rated their workplace's ability to prevent MSDs as good or excellent. Now, while usually self-report measures like this should be taken with a grain of salt, these self-ratings are actually supported by correlations, which show that higher self-ratings tend to correlate with higher scores on the overall index and the safety culture subsection. We have also seen that those who track more leading indicators as opposed to lagging indicators received significantly better results in all subsections. I think we can all agree that preventing injuries before they happen is better than reacting to injuries after the fact. So this finding is something we want to continue to track and support within the pledge community. As for areas of celebration in safety culture, we saw that 65% of respondents currently conduct employee perception surveys. Additionally, a majority of respondents have methods in place for workers to share safety improvement suggestions. It can definitely be argued that no one knows the risks of the job better than the people who do it day in and day out. So employee feedback is a very important step in safety and health. Also, employee surveys, receptiveness to employee feedback, and the opportunity to address concerns are a great way to build a strong safety culture and a psychologically safe environment. Finally, for areas of celebration within innovation and collaboration, our main area of celebration here relates specifically to innovation. As I mentioned before, 82% of respondents are currently involved with MSD prevention in some way. More specifically, 37% are currently using a technology solution, 14% are testing or trialing one, and 31% are actively researching a technology to potentially implement in their workplace. As I mentioned before, safety technology is a big topic in safety and health right now, and it's encouraging to see so many people already utilizing these innovative solutions. So finally, turning to opportunities for improvement. These are areas we've identified that the MSD Solutions Lab will be devoting more time and effort to better assist the community where help is most needed. So for starters, we saw that 17% of respondents do not currently have an ergonomics or MSD prevention program in place. This is definitely an important starting step in an organization's MSD prevention journey, and it's a clear area where we need to devote time and resources. For anyone looking for a starting point on this front, we do currently have a resource on our website for developing MSD policies and procedures. Additionally, almost half of our respondents do not have risk reduction goals in their workplace. Having actionable goals is one of the first steps to be taken in MSD prevention, and it's definitely an area that we want to offer more education and resources. And finally, a majority of respondents reported that they believe non-physical risk factors play a role in the incidence of MSDs in their workplace. However, of those who indicated that they believe non-physical factors play a role, only half of them could quantify the impact of those factors. This finding, among other feedback, has contributed to the decision for our next research paper to focus on the non-physical risk factors of MSDs. So now that I've walked through those results, I will be turning it back over to Paige to talk about the future plans. So what's next for the index and also what's next for the lab.
Alrighty, thank you, Taylor, for that nice deep dive into the index results. And so, like she said, I'll be talking about what's next for the index, and a little bit about what's next for the lab and ways that you can get engaged with us coming up. Alrighty, so what's next for the index? So looking ahead, we are planning for, like we mentioned, that year-over-year data collection or longitudinal data collection, with the second annual index actually being out for completion right now by those in the MSD Pledge community. And so we're going to continue to use those findings from the index to determine trends across Pledge organization, which will in turn inform our future resources and our research efforts. So like Taylor mentioned, we noticed that there was a lot of ambiguity around how to measure non-physical risk factors that was found from the index. And so that is a direction that we wanted to take our future resource on non-physical risk factors in the future. We're also going to continue to track the progress toward reducing MSDs across the Pledge community. So that's definitely a goal of continuing the index on. In the future, we're going to continue to create and distribute those individual reports as organizations complete the index. We'll also release annual reports that summarize the key findings from the index across the entire Pledge community in aggregate. And while this might be something further down the line into the future, we do plan to statistically validate the index. And so without getting into the weeds too much here, we will need a much bigger data set in order to validate the items on the index. And so this will be something that we'll be working toward in a few years when we have that substantial data set. And so, like I mentioned, we do release annual reports yearly on the index. And so the index report from the 2022-2023 findings that we cover today is out. And so if you'd like to kind of take an even deeper dive into those results, feel free to scan this QR code so that you can get access to that report, or we can also drop that link in the chat for you all to check out. And these resources and many, many more are all available on our website as well. Right. And so just kind of a peek into some of those resources that you could find on our website. We have a lot of resources that can provide you with more information about MSD prevention and mitigation for organizations of all different maturity levels as well. So as far as resources, we are regularly adding new resources to our website, and information about those resources are often released through NSC emails and NSC's social channels. So be sure that you're following NSC and are subscribed to the NSC emails to make sure you're getting fresh information about our resources. And on our website, you'll also find lots of brief reports, infographics, case studies, industry spotlights that are really jam-packed with both broad and more focused research and information. And as far as some upcoming resources, I know we've teased one, but the lab is also preparing another report on DE&I and MSDs. That's slated to be released here in the next couple months. So this paper will focus on the importance for considering DE&I when designing and implementing MSD prevention initiatives. And like we've mentioned, we're wrapping up a paper on non-physical risk factors of MSDs, which really dives into psychosocial, organizational, and lifestyle risk factors that might lead to MSDs, as well as some really concrete ways to actually measure those non-physical risk factors in workplaces, since that seemed to be an area that some of our pledgees needed a little bit more information. And so both of these resources together are aimed to provide a more holistic view of MSD prevention and mitigation. So we also have a few events coming up. So in just a few weeks, we'll be hosting a free virtual town hall on MSD medical management, where we'll hear from speakers from OSHA and from safety experts from large corporations as they share how they navigate managing musculoskeletal injuries in the workplace. And then coming up in May, we have the NSC Spring Conference and Expo in Rosemont, Illinois. And then later this year in September, we have our flagship event the NSC Safety Congress and Expo in Orlando, Florida. And so we can also get the links to those things dropped in the chat for you all so you can learn more about them and get registered as that fits with your interests. And so I know that some of you might be in the midst of strategic planning or thinking about your safety goals for the coming year. And so as we kind of wrap up this portion of the webinar today, I want to encourage anyone that has not yet joined the pledge community to take MSD Pledge 2.0 and make that a key component of your organization's roadmap moving forward. And so if you want to get involved in the pledge and you're not already a member, please consider signing, and we can drop that link in the chat as well. There's lots more information about the pledge itself on our website too. And if you take the pledge, it's still not too late to both take the pledge and take the index for 2023, 2024. So if you're interested in getting these kind of tailored individual reports like we mentioned throughout the webinar and getting some feedback about your own MSD prevention journey, you can take the pledge and then take the index and we can get you a report within 90 days of completion. And so we're really proud to continue our ongoing work to transform workplace safety, and we look forward to the work that's yet to be done. So thanks everyone for joining today, and we can open it up for questions now. And I do see that we've gotten some so far, so I will try to navigate that as best I can. And Taylor, feel free to jump in as well as I get things pulled up too. Well, let's see. I see one that came in that says, I may have missed it, but was there an analysis that correlates age of the workforce to specific MSDs? And so that is not something that was looked at through the index. We did not ask age of workforce. We did ask some questions about the percentage of workforces that might be hybrid or remote. And we're kind of yet to tease out some of that data since it wasn't directly related to some of the pledge commitments. But we have not looked into the age of the workforce. There is some information out there on age of the workforce and MSD risks and propensity to suffer from MSDs. And that's the kind of thing that will be touched on in our diversity, equity, and inclusion paper that's coming out as well. So nothing within this report, but plenty of information out there on that and a little bit coming from us when that report is published.
Yeah, I also see a question about giving some examples of leading indicators. Leading indicators are anything that can head off an MSD before it occurs. So this is things like program audits, safety training completion, proactive risk assessments, or eliminating jobs with high MSD risk.
And yes, I see a question that came in that says, are results reflective of only businesses who have taken the pledge? And the answer is yes. Those who have taken the pledge are invited to take the MSD Solutions Index. As we collect more data, there is an interest to kind of juxtapose the answers that we're seeing from those in the index community with BLS averages, especially by industry, to make that comparison to see if there's differences between those in the pledge community and those kind of more normative data on some of these things. But yes, results are just reflective of those who've taken the pledge.
I also see a question here about what do we think is the biggest takeaway from the MSD Solutions Index? I think Paige and I could both answer this one. I personally think that the biggest takeaway we saw is that organizations who consider more of those leading indicators, so taking that proactive prevention of MSDs, saw higher results in all categories. So the overall index and all three of the subsections, which I think is a very powerful finding.
Yeah, I agree, Taylor. I think that was something that maybe we would have had a hunch toward when we went into things, but it's just, especially as researchers, it's really nice to see that validated in the data. And I think it gives us some validation of the tool as well before we're able to statistically validate the tool down the line.
I see another question asking if the hair industry has been explored as any part of these findings. I do not believe we've seen any of that specifically, but if you want to check out our website, we do have what we call industry spotlights. Again, I don't think we have anything as specific as the hair industry, but I think we have some service industry ones that touch on a lot of the risk you'd see in that industry if you want to check those out.
Yeah, and I see a question that came in about examples of MSD prevention technology. This is turning into a lot of things, but I think some of the most common that we see are different types of wearable technology. So things that workers could wear maybe on their wrist to alert them if they're in an awkward posture or doing a movement that's unsafe. There's also computer vision, which can be utilized to understand how workers are moving throughout their environment to also kind of alert managers and sometimes the employee that the position that they're in might be vulnerable to getting an MSD. Folks are increasingly utilizing things like AI in MSD prevention, and we actually have an emerging issues report on AI coming out soon as well. That'll really dive much deeper in how AI has been currently used in MSD prevention technology and what we kind of see as the route for that going forward. Things like cobots and robots have been utilized to totally take the worker out of the situation, especially if it's something, really risky. So there's a lot of things around this as well. And we do have, and we can follow up with folks who put questions in here as well, but we have a nice infographic on different technologies that have been used for MSD prevention as well that we can send along, if that would be of help to the person who asked this question. I see a question, is there an opportunity to look at results by industry sectors? We do have the industry sector breakdowns in the full report, so you can see the percentage of folks that are from each sector. It's something that we have to consider on the back end from a confidentiality perspective. So making sure that we have enough representation in each of those industry sectors in order to be able to confidently aggregate across to make sure that all organizations are protected. So I think as this data set grows over time, it's certainly something we can look into. But we, at least in this first year, we're not able to disaggregate by industry sector. And yeah, I see a question about any additional details related to the high safety culture values indicated in the survey. I think we were pleasantly surprised that there was a decent amount of frontline worker involvement. That was a big kind of matrix item within the safety culture section. And it seemed that organizations were involving their frontline workers in a lot of those kind of decision points. And I think Taylor went over some of those in her section, things like their workflow and their schedules, some of the equipment and tools that they get to utilize. So I think that was a place where we saw some high success of those folks who were taking the index in the 2022-2023 cycle. Also, I think having a level of open communication between folks at different levels of the organization, and more specifically open communication about safety and risks, was also an area that was really important, and that contributed to some folks receiving higher scores in that section.
Another question here, was there anything that surprised you after analyzing the responses? I think the finding that surprised me the most is actually, I guess, an absence of a finding, and that's that we found no correlations between index results and an organization's industry or size or how long their program has been established. We did, I think going into it, expect to see some of that, but it's actually kind of nice we didn't, because it does indicate that, even if you're a small business who just started your program and is just getting into MSD prevention, you can still get good results and some good progress. Another one here, some examples of PPE interventions. So that is anything at the personal level. Page if you want to fill in there as well. So I know people mostly think of PPE as hard hats and stuff that don't really affect MSDs, but things like boots or harnesses may.
Yeah, things like gloves, maybe. And so that item was also asking folks about what was their most commonly used intervention type. And so I think folks might more commonly use things like PPE, but maybe they dabble in using tech or other types of interventions. But that was kind of looking at their most common used types of interventions to see kind of maturity wise where folks were landing more on the hierarchy of controls for the types of things that they're doing to circumvent MSDs. See, I see one here. The biggest opportunity for organizations based on index results. I don't think we've gotten to this one. I think that's a good question. Really from all the results that we shared on the index, I see some opportunity in the risk reduction and innovation and collaboration sections. Like it was noted in someone else's question, the safety culture subsection was the more highly scored upon. So that kind of leaves risk reduction and innovation and collaboration as areas for improvement. And more specifically within risk reduction, we didn't quite touch on it in the presentation today, but we noticed that a lot of organizations reported that they did not use standardized risk assessment tools or measurement devices, but instead used more like self-developed assessments or things made in-house. And so there might be some utility in kind of unpacking that finding on our end a bit more to figure out why that might be, and is it an access to assessments kind of thing. But I'd be interested in digging into that a little bit more too. And I think this baseline year has also shown that we need to continue to devote, focus and resources on technology awareness and adoption. I think it's great to see that people are thinking about and researching technology, but we know that there can be some big power in implementing some of these tech solutions. So how to get people, on board to trial these things, something to look for moving ahead.
Yeah, another question here. Were there any notable trends among organizations in regard to their index responses? I think one interesting trend we did find was related to an organization's size, and that was that smaller or medium-sized companies were more likely to have their program in place for a shorter period of time. So those smaller businesses tended to be new within the last 5 years having that MSD program implemented, whereas larger organizations, their programs were, I think, about 10 years of age or longer. So.
I see a couple like more manufacturing specific questions here. So how many manufacturing companies engage in safety and health management? I think that's the kind of thing that when we have a larger N, especially for that manufacturing industry representation in the results, we'd be able to answer a question like that more, at least a percentage that we could share. But that's just something that right now, given the N count that we have, we just quite can't make that claim yet.
We have another question here about, are we extending this type of survey to get feedback from those who are doing the actual work, i.e. the workers? And the answer to that is yes. We are actually in the works on that survey right now. So adapting the index itself to go out to frontline workers and hopefully get their perspective on this as well.
I see another one here that I really like, tips on integrating this into academics to provide for an immersive experience for higher ed OSH students. I think that sounds super cool. And I think that's something that we could probably discuss over email, but I think we would love to get some of this information and the resources, into as many different community types as we can. So any way we could collaborate there, I think we'd definitely be interested in. And I see that there was also a question about contact info for us. And so, yeah, you can contact Taylor and I at this email that you see here on your screen. So MSD Solutions Lab at nsc.org. We can get that routed to us and answer any questions.
Some questions rolling in.
Yeah, I see another question in here about how it can be hard to kind of get the organization maybe on board for MSD, even awareness and then prevention of those things, and the importance of using standardized testing and whatnot. So how did you begin rolling out an MSD program, getting things like education and buy-in? And I think that's a place where we have a lot of great resources on the website. So when we first rolled out the MSD Solutions Lab and we're making resources, we recognized that this was going to be an issue. Like, how do we even get people on board from the beginning? And so there's resources like how to get, your manager buy-in, kind of what are MSDs, like very basic MSDs 101 type of resources. Like was mentioned in the webinar today, things like policies and procedures, and lots of samples that you can see as well. So yeah, I think, getting that kind of leadership buy-in can be really important. And I hope that the resources on the web can help there, but please feel free to reach out to us if you need anything else, and we can do our best to help. And yeah, I see a question in here too about maybe why mature programs didn't show that great of a correlation or a correlation at all with higher index scores. Maybe it's because culture might be more difficult to change for these folks, harder to get, change made in such a big organization. I found that interesting as well. And I think that's something that I'm hopeful by seeing more data roll in, we'll be able to kind of tease that out a bit more. You would think that a more mature program would have a higher general score on the index. We did see that more mature programs had higher scores on risk reduction, just not on their overall index scores. But that's something that I would like to pay more close attention to this year as we see more data roll in.
We have another question about, do you think you can make the employer accountable for MSD prevention of MSDs through this effort? Are there any positive feedback from the pledgees? We have received positive feedback from our pledgees, and I think that kind of accountability, maybe not as strong word of accountability, goes back to those individual reports. So we really want to make this approachable of like, how are you doing and where are some very clear areas that you can improve? So not really like wagging our finger at anyone and holding them strictly accountable, but really trying to guide people through where they can make improvements and how best to do that. Are there any more questions from attendees?
Well, all right. Thank you all for engaging so much here at the end. We really appreciate it. And if there was anything that we didn't get to or that we need to do further follow-up with, we'll get kind of the download of these questions on our end and can reach out to folks that way. But please, like we mentioned, feel free to reach out to Taylor and I through this MSD Solutions Lab at msc.org email. We can get you connected to the right resource or, just to us if you have further questions. But thanks again, everyone, for joining today, and stay safe.